Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi, and here with me in the studio is Rafia Lodhi. So this episode is everything you needed to know about vaginismus. It's a very, very important topic. So we're going to spend this episode just discussing that one topic. And as before, the first thing I want to make very clear is that I am not giving any type of religious or medical advice. So if you are having any medical issues, please speak with your medical provider. And if you have any questions regarding your religion, please speak with your neighborhood religious leader. And this is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. Today we're talking about vaginismus. And as a wise man stated, the pronunciation sounds similar to Christmas, but is not as fun. And I think that is very, very true. So vaginismus, Raf, I'm sure you're probably thinking, what is that?
That was my first question. Like, what is vaginismus?
All right. So it's basically the body's response to something that it's anticipating as painful. So what happens is that we have the vulva, which is the external part of female genitalia that a person can see. And the canal that is in the vulva is called the vagina. And oftentimes I think that people confuse the two, right? They consider everything on the outside the vagina, and that's a misnomer. And that's something that, and even I, as a gynecologist, sometimes get sucked into that. But the true nomenclature or the wording for the external part of the female genitalia is called the vulva. And that canal, which connects the uterus and the cervix to the outside world, that tube is called the vagina. And so what vaginismus is basically an involuntary contraction of the muscles that surround the vagina in anticipation of something that it thinks that it's going to, the woman feels, right? The vagina is not thinking, but it's the woman that feels like there's going to be pain involved in whatever she's about to do. So it could be, say if it's placing a tampon in, or say if it's like a vaginal exam, or say that it's like a speculum exam, and of course, penetration with sexual intercourse. Something that I see a lot is women in labor, and as they're going through childbirth, really, really anticipate pain when, say, the OB is about to check them to see how dilated they are. And women tend to really contract those muscles and anticipate a lot of pain. What we tell women that are in labor specifically is just to take a deep breath and breathe so that we're able to check them and to see how far along they're dilated. I see that a lot actually in the office as well, where I'm about to do a speculum exam and women anticipate a lot of pain. And so then those muscles will contract and, the gynecologist or the healthcare provider, whoever is examining the patient, is not even able to do an exam because those muscles contract and the patient anticipates a lot of pain.
Okay. Are there any types of vaginismus?
Yeah, so typically there's something called primary, and then there's another different type called secondary. So the primary vaginismus is when a woman has always experienced pain, and so she doesn't know anything different. And she always, whether it's with an exam or with penile intercourse or even a dilator, she may be anticipating pain. And so that's considered primary because she's never had any type of examination or intercourse that, or even a tampon placement, anything like that involving the vagina where she hasn't experienced pain. So that's considered primary. Secondary is one in which, say, that a woman has had intercourse before that she was fine with, didn't have any problems or issues with in the past, but now all of a sudden she's developed this pain or where the muscles start to contract involuntarily. So that would be considered secondary. So that's secondary vaginismus. And sometimes that can happen. Say if somebody has or is going through, for example, chemo, where that vagina starts to become thinner, and that the tube, if it contracts and becomes smaller, and what we consider atrophy, so something that gets smaller,
Mhm.
right? And that can happen sometimes in, say, like somebody that's gotten like radiation to that vagina, or somebody that's had surgery, pelvic surgery, and so their vagina has become a little bit shorter.
Mhm.
It can also happen, say somebody's had like an infection that's never completely cleared up, for example, like say like a yeast infection or something like that, and so that vagina is irritated, and so that could cause pain. It could also be due to, say, like trauma, right? Or somebody that may have experienced a rape or a sexual assault, or um, something like that, where now they have those negative thoughts and feelings surrounding intercourse or penetrative intercourse. And now their muscles tense up because they anticipate something very painful.
So, are there any symptoms of vaginismus?
Well, basically what happens is that the women will automatically notice that their vagina tenses
Mhm.
up. So, right, so they're about to either, have an examination, whether it's that pelvic examination, if they're about to have intercourse. So it is involuntary,
Mhm.
right? So it's just something that happens, but a lot of it is psychological, right? So it's the anticipation, it's the fear that something is going to be very painful for the woman, and so that's why she starts to have that involuntary contraction. The symptoms of it basically would be that upon penetration, whether it's with a tampon, a speculum, with the fingers, for a vaginal exam, or with, penile intercourse, that, or dilator or anything like that, that those muscles automatically contract, and the woman experiences pain because those, right? So nothing can get through that vagina because those muscles tense up.
Mhm.
I know that a lot of women tend to experience this, especially those that have had negative experiences in the past with intercourse, or those women that, for example, have never had intercourse, right?
Mhm.
And so, say it's like their first night, and their wedding night, or the first time they have intercourse, and because of perhaps some stories that they've heard from other women that sex the first time is going to be painful, or they're not going to enjoy it, or something like that, that they will then automatically have those perceptions and thoughts in their head, and so then those muscles will tense up, and so it's almost like a self-fulfilling prophecy, right? So that they're already thinking that it's going to be painful, and of course it will be painful because those muscles have tensed up, right? So for women such that are experiencing that, it's very difficult, right? So that those kind of thoughts and fears start to impact their life. And they start to, it starts to affect their self esteem. It starts to affect their relationship with their partner. And, oftentimes they feel really bad, and, perhaps they start to have a low body image, right? So it starts to impact a lot of different facets of their life.
Is there any type of cure or something they can do to prevent this from happening?
Yeah. So oftentimes, what we tell women is to, actually, what I will say, Raf, is that the biggest thing is to work on those thoughts, right? And those fears. I mean, there's lots of things that we can say that, oh, yeah, maybe do this or do that, or maybe try the Kegel exercises to improve like conscious control of those muscles so that you get used to penetration, right? And Kegels are exercises that they use to, strengthen up that pelvis, those muscles in the pelvic diaphragm. Those are the muscles that those Kegel exercises tend to work. But I often find that for women that experience vaginismus or that have that, really the most important thing is working on the brain, right? Is working on those thoughts and seeing where they stem from. If it comes from a fear or something that they've experienced in the past, then it's so important to work through that and to work through those fears, right? And to kind of break them down and see where perhaps that patient needs therapy, right? Perhaps that patient needs to see a psychiatrist to work through all of that past trauma that they may be carrying with them through all these years, right? And so, because of that trauma, they're not able to enjoy, say, of what they might consider to be a fulfilling sexual relationship with their spouse. Or even for that matter, just to even have a speculum exam or to have a vaginal exam during labor and delivery, or to even put a tampon in, right? So all of those things, it's so important to just work through what it is that's causing that fear, right? And whether or not somebody else may think it's rational or irrational fear, it doesn't really matter. It's really about that person, that patient, and it's about what they've experienced and to work through that trauma so that they can get to that next point where they're able to, slowly say they try like dilators, right? And slowly they start to work through all the issues that they might have and slowly allow their vagina to relax when something starts to penetrate it so that the muscles don't automatically tense up. And it's about retraining the brain. It's about teaching it that it's not going to be painful, or that that they can overcome this and that they have full control. And I think that's one of the biggest things, right? A lot of times we have fear because we feel that things are out of our control. So it's the fear of the unknown. But when they realize that what they're going to experience, that penetration is in their control, right? So perhaps they had trauma that they experienced before that was out of their control, but now you're putting that power back into that patient, right? With that patient. And so they're able to control whether or not they put something in or they don't, whether or not they allow, an exam to happen or whatever else. Say, they want to become really intimate with their spouse, right? But they have that ability to verbalize and say whether or not something feels good or something does not. And you can work through that, right? It may take weeks, it may take months, but knowing that there is a way that you can fix it if you desire, right? Like say some patients, right, they're just not interested, it's not something that's important to them and they don't want to work on it, then that's fine as well because that's their decision. But it's putting that power in that patient's hand so that they're able to make their own decision, right? And oftentimes women that experience this, and specifically I'm talking about women from, it can be like say anywhere, that have had a bad experience or have been brought up thinking that sex is shameful or dirty, or feel guilty about sex, may also be experiencing these type of symptoms where the muscles contract involuntarily. So for these women, it's so important to work slowly through their thoughts and their feelings so that you can get to a point where they may be able to, have that penetrative intercourse. And like I said, it could take weeks or months, but if it's something that they desire, then, it's important for them to know that there is a pathway to do that. And again, working with a therapist, working with a coach, like a sex coach, all of those things help. Starting out with dilators, maybe starting out with some type of touch just on the outside of the vulva, maybe even for some women, masturbation works, right? For some women, it's using dilators and slowly working up to the point where they're able to have intercourse where they don't tighten up. And really, it has to do with working on their fears and what's causing it.
So, is there a specific way a doctor diagnoses this, or the patient just has to tell the doctor, "This is my fear"?
Yeah, so that's a good question. It could be either. It could be that, oftentimes we know as providers, right? So as we're seeing a patient, as we're trying to examine them, automatically, their legs will close up, or they'll start to say, "Oh, I'm having pain," and you haven't even touched them yet, right? So it's that anticipation, it's that fear
Mhm,
that it's going to be so painful, that the touch is going to be so painful that the women will automatically, their muscles will automatically contract. So they may not even say that they have this, right? They may not even know what this is,
right.
but the provider will know exactly what's going on
Mhm,
because they have so much anxiety
mhm,
and stress about their exams, and so much fear that it shows even without somebody talking about it or saying that they have this.
mhm. Can they use, when they do have painful intercourse, can they use anything like lubricants or anything like that to kind of ease their pain?
Yeah, so it definitely depends on like what type of pain that is,
Mhm,
right? So is it pain just with initial penetration? Is it pain with like deep penetration? That's really where it boils down to. So if it's just even on entry, absolutely, you could definitely use lubrication, and you could even use lubrication with, deep penetration. But if a patient is not even able to get to that point,
mhm,
right?
mhm,
So if they're not even able to get to the point of even a little bit of penetration because there's so much fear,
mhm,
the most important thing is to work on that fear,
mhm,
right? So that's where like an open communication with your spouse comes in handy.
mhm,
And it's so important, right? To be able to discuss with your spouse and your partner your fears, your anxieties, and let them know what's going on, maybe the trauma that you've experienced, so that they can also help you
mhm,
and slowly work with their partner, their spouse, whatever, to help them ease into, you know, a relationship where they can be extremely intimate with their partner. But that's all, again, that's if they want to. But it's so important to be able to communicate with your spouse so that
mhm.
you can tell them.
So, a healthy lifestyle, would exercise help too, just to kind of maybe relieve that stress, um,
Yeah,
get them to think about other things, like you were saying?
right. Absolutely. So, because stress plays a huge part in this, in vaginismus, and really with most things related to intimacy and sexual intercourse, right? So, decreased libido is also, your libido is also affected by stress, and it can decrease your libido if you're constantly stressed, right? So also being mindful. So mindfulness is huge actually when it comes to vaginismus, and helping to, and part of the therapy, along with discussing with the therapist, traumas, is this mindfulness and what we consider cognitive behavioral therapy. So focusing on the moment, right? So just, there's so many things going on in our heads all the time. But if we're able to calm our minds and just focus on what we're doing at that moment in that time, that also is very helpful for vaginismus. So definitely managing stress and managing what we're thinking about really helps with just the vaginismus, but also increasing arousal, increasing libido. Multiple studies have shown that mindfulness helps in all areas, and especially in sexual relationships with their partners or with spouses. Mindfulness is huge. So, yes, helping and treating stress makes a huge difference in treating something like
So
that.
there isn't a medicine that they could take that would help them, a magic pill, that would help them, or nothing has been created just yet?
No, I mean, if you think that your anxiety, if a patient feels that her anxiety is so
Hmm.
much with the thought, even just the thought of being intimate with somebody, then I suppose she could definitely take, what we call an anxiolytic. So something that helps with the anxiety, definitely depression, right? So this type of condition, vaginismus, can also cause depression, right? So if you really want to become intimate with your partner, but you're not able to because you have vaginismus, then, say you get into depression because you're not able to become intimate, then it becomes like this vicious cycle, right? And so then one kind of preys on the other, and a patient is not able to get better. But, in terms of like a magic pill, there isn't such a thing. I mean, if a patient has really bad anxiety, definitely get the treatment for that. A patient has really bad depression, it's important to get all of anything that affects your mental
Yeah.
health will absolutely affect, your intimate life.
Hmm.
So if that is, what's going on in a patient's life, then it's so important to get that addressed and treated. And absolutely, that would definitely help. But just taking medication for the sake of taking medication just to help you relax, no, I don't think that that's really a good idea. I think the best thing is to work through whatever it is, right? Because if we don't work through the trauma, if we don't sit in that pain will never heal,
Hmm.
right? So I like the analogy of, even when you cut
Yeah.
yourself on your hand or something like that, there's a healing process. And after a while, initially it hurts, but after a while that pain dulls. And then you don't even realize that that pain was ever
Hmm.
there, right?
Hmm.
So the same thing with any type of mental trauma or mental, things that, like for example, vaginismus, right? So it's important to work through what our fears are so that we're able to heal.
Hmm.
And once we're able to heal, then we can move
Yeah.
forward. But there's nothing that's going to fast forward that healing,
Yeah.
right? It's on us to work through that pain and to work on ourselves
Hmm.
so that we can move forward.
Okay.
So, like we were talking about before, it's so important for people to realize that vaginismus is a treatable condition, and that, most of the patients that are able to get help and work through their fears and their anxieties are able to eventually relax and allow those muscles to relax so that they too, if they desire, right, if the patient desires, can experience a fulfilling sexual life if that's what the patient wants. And it's so important though, if you're having vaginismus, is always go to your doctor, your provider, to make sure that there's nothing anatomical, right? So nothing like that's actually in the vagina that's causing pain, right? That's of course first and foremost. You want to make sure there's nothing anatomical. You want to make sure there's no infection. There's nothing that you're missing that may be causing pain. So that's the very first thing that a person should do, is always make sure there's nothing actually in the vagina that's causing pain, right? So once you've worked out all of those, say, anatomical causes that may be causing pain, then you can work on the psychological issues that may be resulting in the vaginismus, resulting in that involuntary contraction. Oftentimes, this condition, will not require surgery. It's most of the time it has to do with working through, our fears and what it is. And it's just important to know that, again, there's no quick fix. It's just about working through whatever it is that may be causing those thoughts and feelings. So, yeah, I think it's an important topic to discuss. And I think that a lot of women feel shame because, they have this condition and may not have the vocabulary for it and may not know what it is, but notice that it is affecting their relationship. And so it's important to be able to put, a word to their condition so that they can go and seek help if that's something that they want to do. And to know that it's treatable and that there's nothing wrong with them, right? That they don't have to feel bad if this is happening.
Yeah.
So,
Like people from different cultures who don't talk about sex may not even know that this even exists. And then
right.
if they can talk to the doctor, then definitely this would be a step forward in healing.
Yeah, absolutely. Absolutely. So, okay, well, that is it. I think we are done here. And so it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So if you're having any issues would say something such as vaginismus, please go ahead and see your healthcare provider for any and all concerns that you might have. And until next time, this is the Muslim Sex Podcast. Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. And until next time, this is the Muslim Sex Podcast.